Let's turn now to Borno State, where government says it's on the verge of eradicating a number of infectious diseases, including polio, Guinea, and tetanus among mothers and newborns. Commissioner of Health and Human Services, Malam, Gana, disclosed this to newsmen in Maiduguri at the commissioning of the World Health Day. TVC News' Jessica Fida reports.
The Borno State Government has continued to bridge the healthcare gaps created by the 13-year conflict. For more intervention towards improving the sector, 15% of the state's budget was allocated to the ministry. At this hall are government officials and healthcare organizations. They are here to commemorate the World Health Day. The State Ministry of Health attested to the decline in both the maternal mortality ratio and child mortality under 5.
Our government is doing long to improve the healthcare services of these people by constructing a lot of healthcare facilities, a lot of capacity building training, and procured a lot of essential medicine and medical consumables to the people of the state. All this is showing to improve the healthcare services of these people. Our government is so passionate about the healthcare of their people.
The World Health Organization, on its part, assured to continue working closely with the government so as to achieve a universal health coverage and the people access affordable services.
We're also supporting the state government to ensure that medical commodities and supplies are available in the front line. We are indeed, of course, supporting other areas of demand creation and availability of vaccines and other medical products. So we do this through providing the financial resources and the technical support to the government. We have been working to facilitate a lot of reforms within the health sector. Like I mentioned during my speech, we have seen that the government has undertaken reform in the Primary Healthcare Development Board. That will reposition the agency to become more effective.
To develop the state healthcare system, particularly at the primary level, health organizations and partners are urged to collaborate with the state government. The theme for the 2024 World Health Day is My Health, My Right. Jessica Fida, TVC News, Maiduguri.
Executive Secretary, Borno State Primary Healthcare Development Board, Dr. Arab Mohammed, joins me now for more of this development. Dr. Mohammed, thank you for joining us on TVC News at 7. Precisely, what is the state government intervention in the primary healthcare sector to curb the spread of infectious diseases?
Thank you for having me. Well, to start with, His Excellency Professor Babagana Umar Zulum, the Executive Governor of Borno State, has a great passion for health. His Excellency has ensured that every aspect of the primary healthcare services activities are supported by the government. In recent time, as you've heard earlier, 15% of the 2024 annual budget is allocated to the health in general. However, in the area of primary healthcare services, he has made enabling environment by providing all the necessary infrastructure. One, he has recently directed us to employ 1,000 healthcare workers to the primary healthcare development boards. In that regard, that means all the primary healthcare centers are to be equipped with human resources for health. That notwithstanding, in the area of physical infrastructure, there is now ongoing reconstruction, renovation of primary healthcare centers across the state. That note, again, notwithstanding, we also has made it available. Drugs, particularly free drugs for maternal and child, under 5 children, are provided with free drugs. Again, we have 2 gateways in providing free, affordable drugs at the primary healthcare level. We have the contributory gateway as well as primary healthcare gateway through the Basic Healthcare Provision Fund. The government, under the distinguished leadership of our governor, the people's governor, he has made all efforts to see that counterpart fundings are promptly paid.
All right.
That means that
Dr.
other
Mohammed,
activities
Let me
Yes,
butt in
please.
quickly. I get what the government has done, but what's been done to enhance accessibility? Just 2 weeks ago, it was reported that some 16,000 people affected by tuberculosis are not yet receiving treatment in Borno State. So if government is doing this much, how do you intend to bridge that gap of having those who need these facilities access them?
Yes. Accessibility to the facilities, people at the grassroots level, first and foremost, you have to make them aware the importance of the primary healthcare centers in the localities. So there is now sensitization of people to access the healthcare facilities. But that notwithstanding, availability of manpower, availability of diagnostic, as well as provision of the drugs, all these are being made so that people come to the primary healthcare services, because these are the first point of contact of the people. So we are actually now sensitizing people to access this. Now, yes, it's true, these records of having high level of tuberculosis and other things, but government has come to now attend to all these problems by now getting the people to accessing the healthcare services at the grassroots level. So, presence of the manpower, making available diagnostic tools, then availability of the drugs. So all these are actually made available so that people can access it, and we will actually overcome the issue of the high cases of tuberculosis in the state.
Dr. Arab Mohammed is Executive Secretary of Borno State Primary Healthcare Development Board. Thank you for talking to us on the news tonight.